it scared the crap out of me. Yeah, I do have a story about a medical emergency with a patient I can tell you.
Oh, I'd like to hear it.
So the story about a patient lying. So a patient filled out everything. No medical history was all no's. No issues whatsoever. The perfect
Perfectly
healthy
healthy.
person. It turns out they were diabetic. And so this patient had been waiting 3 or 4 hours to be seen. And we were doing like 4 or 5 crowns on this patient. So it was a long
Big
appointment
treatment,
already.
yeah.
So we took blood pressure. It was fine. And then we started treatment, and we propped the patient's mouth open like we usually do so they can try and relax and not have a sore jaw afterwards. And we started doing all the crowns, and we got the 4 or 5 crowns done. And then we went to do something with the patient, and she didn't move.
Oh, no.
She was basically in a coma, and we had no idea because we were just working. We wear these loops. They're called loops, these little magnifying glass. And literally, I can only see like the size of a quarter. I can see like 2 teeth through those loops. And so I'm working away, and I'm not paying attention to anything, and we're going, and she's holding nice and still for us, and it's great, and we're getting all the work done. And then we have to check some of the clearances, so we take the little block out and ask her to close, and she just doesn't respond.
That's got to be scary.
Oh, it scared the crap out of me. Yeah, it was really scary. And I think I've been out of school like a year.
Oh.
And so I grabbed her and like pinched her like on her shoulder really hard. Anyways, so I grabbed her and pinched her, and then she kind of woke up, but she was really confused. And so luckily her spouse was in the lobby.
Okay.
So we went and got the spouse immediately, and the spouse was like, well, her sugars are low. She hasn't taken her sugar today. And we're like, but her medical history didn't say anything about that. How were we supposed to know? And she waited for 4 hours. And so we had glucose in the practice. We gave her glucose. She came right through, right back, and everything was totally fine.
But that would have been nice to know before you started a 2-hour procedure while she'd already been waiting for 3.